Hey everyone, Dr. Singh here back again with another video, this time about the Delta variant. Recently, right here in Trinidad and Tobago, we had a few cases that were confirmed with the Delta variant. Now, what is the Delta variant and why is it so worrisome? Now, the Delta variant is basically a strain of the COVID-2 virus that was discovered in December 2020 in India. Now, this was the strain that caused a lot of issues in India, whereby there was overwhelming of their healthcare system. Now, the Delta variant also affected many other countries throughout the world. There were so many countries that successfully managed the previous strains and they actually relaxed their public health measures. Now, the Delta variant is very contagious and it is highly transmissible. So in epidemiology, there's a value that is used called R naught. This basically means that it represents the number of persons who are actually affected by one infectious person with the disease. So for instance, the initial strain was the alpha strain, and the R naught value is usually around 2. But with the Delta variant, this value is actually 3.5 to 4, which means for every positive person with the Delta variant, it may affect 4 persons compared to 2 which is seen in the alpha strain. So the Delta variant was actually labeled as the most transmissible strain so far by WHO. But what makes it so transmissible? So a few studies have been done, and the things that they came up with were that 1, the spike protein, which is responsible for interacting with your receptors and gaining entry into your cells, is actually develops a very different shape, a cleave shape, which allows it easier access into your cells at a quicker time. Therefore, the virus is able to reproduce or replicate much faster in a shorter period of time, thereby making you much more infectious. Patients with the Delta variant were actually shown to have much higher viral loads, thousands more when compared to persons diagnosed with the other strains, whether it be alpha or beta. So while the Delta variant is much more transmissible, is it more severe? So 2 studies were done, one coming out of Canada and one from Scotland, actually showed that patients with the Delta variant are more susceptible to being hospitalized. In addition, in the REACT-1 round 12 report, the Delta variant has shown to have a 2.5% increase in prevalence in persons aged between 5 years and 49 years of age when compared to those over 50 years of age. So I think the main issue with everyone will be, should you get vaccinated and how do the vaccines fare against the Delta variant? Now, what is a breakthrough infection? So a breakthrough infection is defined as a person who has been fully vaccinated for a virus but still becomes infected. So then what is the point in getting the vaccine if you can still be infected with the Delta variant? So everyone needs to bear in mind that when these vaccines were being created and tested upon, it was not being created to prevent infection, but actually to prevent the progression to severe disease and hospitalization. So previously, persons who were fully vaccinated and were infected with the other strains, that's being the alpha or beta, it was shown that the vaccine resulted in persons producing a lower viral load when compared to persons who were not vaccinated. However, with the Delta variant, persons who are vaccinated and those who are unvaccinated, it still showed that they both produce the same level of viral load when infected with the Delta variant. So then what is the point in getting vaccinated? The point is that while the viral load might be the same in a vaccinated person, the viral load tends to drop much quicker. Thereby, a person who is vaccinated will not be infectious for a longer period of time compared to an unvaccinated person. With the vaccine and the Delta variant, they will still be effective. However, the efficacy might just be a little bit more reduced. So if we were to compare some of the vaccines that are currently being distributed in Trinidad and Tobago, we have the Sinopharm. When it comes to the Sinopharm vaccine, a study was published in July by Sri Lankan researchers. It was a cohort study with 2 groups of people. One that was fully vaccinated with both doses of the Sinopharm, and the other that had natural infection with the Delta strain. It basically showed that 95% of individuals developed antibodies similarly if it had to deal with the alpha or beta strain. 81.25% also developed neutralizing antibodies, which are the antibodies found in natural COVID-19 infections. When comparing the AstraZeneca, we have two things we have to look at. One, preventing you from getting infected, and more importantly, hospitalization. So bear in mind, this is also compared with the Delta variant. So persons who received both doses of the AstraZeneca, it showed that there was a 60% chance that you won't become infected. Two studies were done, one in the UK and one in Scotland. When it comes to hospitalization, in the UK, there was a 93% chance after having a second dose of AstraZeneca, you won't become hospitalized, compared to 88% chance you won't become hospitalized in a study found in Canada. When it comes to the Johnson & Johnson vaccine, there weren't much values. However, results that were published showed that persons who had Johnson & Johnson showed a better antibody response when it comes to the Delta variant when they compared it with the South African variant. All in all, Delta is surging, less than 1% of cases in May to now over 80% of cases worldwide. The main problem is viruses will continue to mutate. There will be many other strains, and everyone knew this from the start. The main thing is that for viruses to stop mutating, we need to prevent transmission. And right now, persons who are unvaccinated, we will tend to see much greater transmission when it comes to the Delta variant. Also, areas that consist of low vaccination rates. Even though vaccinated people can transmit the virus, they only represent a very small percentage when it comes to transmission of the Delta variant. Hope you found this video helpful. If you did, like and share, and do subscribe for any future content.